Healthcare is different than it was 5 years ago. And even just getting an appointment, being able to set up an appointment. What I found here is that not only is the staff accommodating to just get me in and set up, but they're also willing to talk to me on the phone. I know everybody is different, but for me, the comfort and feeling welcome and feeling home is an important part. So skin cancer in general is in my family. Both my mother and my father have been diagnosed. So I've seen melanoma in my body 3 times. It obviously raises a lot of attention to what the risks are. And so when I come here and see Dr. Connect, we walk through really my aspects of my whole health. But what I like about him, he's a little bit different than me. He's quiet and analytical, and he thinks. If I ask him a question, he likes to think before he answers, which I really appreciate. So not just Dr. Connect, but his whole team here are kind of vested in the whole self-care and how are you doing, and both health and otherwise. And so when you see a doctor at some frequency, it's nice to be able to go back and they understand some aspects of your history, so they can really personalize the care better. So I got my original surgery and treatment and aftercare done at a different hospital. Unfortunately, my insurance changed, and they no longer carried that insurance. And I'll tell you this, it's really frustrating when you build a relationship with a doctor and a facility and your insurance changes and they just really don't have any options for you at that point. I kind of hated to lose my history, so I was frustrated, and I looked and found CLS and I found Dr. Connect, and I got to try something, I got to do something. And so fortunately they were on my insurance plan, and that's how we built the relationship. So my insurance plan has changed twice since then, and this facility has taken all of them. So I feel pretty fortunate I've been able to stay here. So Dr. Connect, I know, has, because I had my surgery and original treatment at a different facility, I know that he reviewed all those records and the original scans and things like that we've done, because we've talked about them. And we talk strategy in terms of, when should the next scan be, full body scan, and I'm talking about a CT scan, an internal scan, just to make sure that the probability of cancer is still low spreading in my body. It's kind of a weird thing, and they have lots of different statistics, but one that they really pay attention to is, are you alive or not alive in 5 years? This is pretty risky stuff. And so I am now 6 years removed from my original detection and excision. So I feel very good about that. I think you're lucky to get that these days, because it doesn't happen very often in a lot of clinics. But I like it, and it doesn't make me have any apprehension about coming, and I know that I can be open and sharing, and if I need help with something, I know that they're here to help me. So I really always feel good about coming here, and really the entire facility. The convenience, and this facility does move a good number of people through here, but the convenience of having multiple practices in one place, in one building, is really nice. I mean, as a professional, it's kind of difficult to get away from work sometimes and set up this appointment and that appointment and all that, so if you can kind of knock them out in a half day or something like that.